From medical procedures to job interviews, we all want to know the same thing. What can you expect? The same goes for rehabilitation sessions with a Bodyworks physiotherapist. What can you expect? What should you receive? We're here today talking with Manira from Bodyworks McNichol to find out more about what happens during a physiotherapy session. Manira, are all of a patient's visits the same when they come for physiotherapy?
That's a great question. Every patient is very unique and they need tailor-made solutions. We at Bodyworks Physio provide the best we can for the treatment of our patients.
So if patients are both having the same pain in the same area, does that mean you treat them the same way?
Good question, Megan. For example, if there are two patients coming in with shoulder pain with the same level of pain intensity, say one having tendonitis, another one having frozen shoulder, my plan is based on their activity limitations at work and at home.
So Manira, what happens during a physio assessment when you find out all this stuff?
When they first come in for their assessment, I take a detailed history of their pain or injury. I have a conversation with them about their routine, their do's and their don'ts, and what is stopping them. That way, I can understand their limitations, and it helps us bring trust between one another. Then I move on to a physical assessment, where I check their range of motion, I check their muscle strength, I do some special tests for their area of injury. It helps me to find out what are the involved structures, and then I can plan out my treatment. My most important question to them at the end is, what is your goal at the end of the treatment? What are your expectations from the treatment? Which helps me to plan out the short-term and the long-term goals. I move on to educate them about their condition and how, as a physio, I can help them to recover from their pain. I customize the plan of care to meet their goal. The plan of care consists of the treatment, details of the treatment, some recommendations, some advice that can help us improve the efficiency of our treatment. I send them home by giving them some treatment plan of care sheet that can help us schedule the follow-up appointments. Most importantly, I give them lots of information about their condition and the rehabilitation.
That sounds a lot that happens in that first assessment. Are your follow-up sessions different from the assessment?
Yes, when they come in for a follow-up session, I have a quick chat with them about their pain, how they're feeling, what their trigger factors have they been following their home exercise plan that I give them, which helps me understand the compliance the patient is having towards the treatment and how far we are from achieving our goals. Moving forward, I quickly check their range of motion because seeing a physical change in movement helps them assure how good they're doing. I move on to giving them a 30 minutes of follow-up treatment that includes pain relieving modalities, some manual therapy, exercise therapy, and various different techniques that I could perform for the benefit of that particular patient. I then review their exercises, I add or progress their existing exercises, and then I send them home with a good home exercise plan they can continue at home.
Wow, Manira, it sounds like there's a lot to cover in one session. That's amazing. With the information that you've given us today, what's the next step for anyone looking to book in with an excellent physiotherapist such as yourself?
You can check us out at bodyworksphysio.ca. We have 3 locations in Scarborough, 1 in Pickering, and I'm sure one of them will suit you. Or you can give us a call on 1-866-7-PHYSIO to have a consultation, either on phone or you can come in for the first assessment.
Wonderful. Thank you so much, Manira. It's been a pleasure speaking with you today.
Thank you.